Recording. All right. Well, good afternoon, everybody. My name is Kerry. I am the Knowledge Specialist, aka Specialist Librarian, for everybody here at Solent NHS Trust. And as part of our National QI Week, I'm going to be giving you a session of just under an hour on using evidence in improvement. If you have any questions, you can pop them in the chat. You can also put your hand up. We're going to be using a few questions on Mentimeter as well. And on each of the Mentimeter question slides, you'll have the code for logging in to the link to the Mentimeter, and also the QR code that you can scan on your phone. So for those who are joining or have just joined, you'll see that the session is being recorded in common with a lot of the other sessions this week. So session is really about using different kinds of evidence in improvement, how evidence and knowledge can help you in your work in QI, and how it can save you time and effort as well. So we cover the different kinds of evidence and how they can be useful for QI and QI adjacent practice like demand and capacity work and clinical effectiveness. We look at how evidence can help before, during and after QI projects. We've got a few examples from practice in health libraries and how they've helped with quality improvement type work. And we've also got a hypothetical case study as well to show you how evidence might work in a real world situation. So I'll take you to the Mentimeter, the interactive bit. And I will share my screen. So the first question on our Mentimeter is, what does evidence mean to you? Having a little think about it.
Kerry, I'm not sure if everyone's having the same problem as me, but it still says waiting for presenter on mine. I don't know if you need to move the slide forward.
Let's see. Any luck?
You did something and it moved forward, and then it went back to the beginning page again. That's it.
Here we go. And this is after me testing it all this morning. Fantastic. supporting QI, data, tangible, measurable. Fantastic. So data is featuring quite heavily, but so is information, so is knowledge, and measuring, and that sort of benchmarking, I think, as well. Softer evidence. That's interesting because one of the things that we look at later on is how things like tacit evidence, the knowledge in people's heads, can also be quite useful for QI practice. So I shall let folks keep going with the Mentimeter if you so desire. So we've gone with our question for what does evidence mean to you? And we've had some really interesting responses to that. And quite often, evidence means very different things to different people. As a librarian, I tend to see it as not just published stuff, but other resources as well. And there are three broad sort of types of evidence for improvement. There's the published evidence, which most people are probably more familiar with, which includes things like journal articles and systematic reviews. It can be most useful for clinical effectiveness, making decisions on patient care, and things like clinical and corporate governance. You also have grey literature, which I think is sometimes underused in health and social care. And sometimes it's because people aren't quite sure how to access it. Sometimes it may feel a bit woolly for what you need. But in a lot of cases, it can actually be really practically helpful. And that's particularly true of quality improvement because grey literature is useful evidence that's not published in that sort of formal academic setting. And that can be things like policies from other NHS trusts, reports from specialist charities and institutes like the King's Fund, raw data from the NHS, from things like Children's Commissioner for Paediatrics, and things like business cases and bids and tenders that have been made publicly available by different organisations. And as we've already mentioned, there's also tacit knowledge, which is knowledge that's bound up in people. It speaks of things like experience, the results of patient and public involvement and co-production, and the knowledge and experience of staff as well. And that can be useful at lots of different stages of co-production and for co-producing interventions. Change management, giving people that why are we doing this? And hearing people's perspectives and incorporating people's perspectives into what you do so that people have that sense of ownership. And it's also really useful for things like organizational learning. A lot of the lessons that you learn from things like serious incident reviews may be around the ways that things are communicated, the way that technology works or doesn't in a particular service, and on experience, how people experience their work, how people experience working relationships, for example. And always remember, I'd be remiss if I didn't say this, your local NHS library can help you access evidence sources, expert searching, and other knowledge support, including things like knowledge management. making what you learn from your improvement projects more easy to find and use. That also goes for anyone who is from any of the constituent nations. Wales, Scotland, and Northern Ireland also have their own health libraries, as does the HSE in Ireland, if anyone is from across the Irish Sea. And if you don't work in the NHS, but you do work in the third sector or in social care, you may be able to access NHS library services if they have an agreement with you. And you can also access different free evidence resources, and I bring up a couple of those in the resource section later at the end of the presentation. So why is evidence important for QI? So the first thing is that it helps you plan your approach. It can help with developing or using existing frameworks, models, whether that is quality improvement models that you work with through your quality improvement team, whether that is working out what interventions have been done before in other organisations. It helps to avoid reinventing the wheel, because if a similar project has been done elsewhere, then you can take the learning from that and use it to move your own project on a stage. It gives insights into what other organisations have done, and that can be useful for seeing where you are in terms of other NHS organisations, but it can also be quite useful for information on social care, public health, social work, and things like education, if you're working with children and young people with learning disabilities, for example. And crucially, evidence of many different kinds, particularly your more sort of numeric, measurable evidence, can help you make the case for a change, whether that is for people who are higher up in your organisation, who you're having to convince to get behind a project, whether that is for stakeholders outside your organisation in things like community partnerships, or whether that is working with the staff who are actually going to have to try this project and be part of those cycles of trying things and reflecting. And there are lots of ways in which you can use the evidence. And evidence, I think, less so in this group, judging by our word cloud, but quite often evidence can be seen as something that is quite academic, quite theoretical, and it can be difficult to see how it can be of kind of practical use in our day-to-day work. But it can inform your approach at any point in a project, though obviously using the evidence from the beginning is always the best way to go. You can use it to mold your question or your topic idea. You may find that somebody's already done some work on this, so you don't want to duplicate it. You maybe take it from a different perspective. The methods for your project. So different ways of running a project to reduce did not attend to your appointments, for example. You can use it to define success, because obviously when you are doing quality improvement, you're trying to find out what quality looks like, as well as how you can build on that quality. So it can give you a really good insight into what good looks like in similar organizations, what matters to the people that we look after. It can help you explore different ways of measuring success, things like patient-reported outcome measures and whether or not they've been robustly tested, looking at ways of measuring the impact of improvements on staff or patients. And it can also, with caveats, help you benchmark against previous projects that have been done in similar areas or similar organisations that may have a similar context in terms of the kinds of communities they serve, that may be similar in size, or that might be similar in their structure as well. And crucially, it helps you use what you've learned because it can give you ideas for driving engagement. It can let you see the most effective ways that other people have disseminated their work. And it also helps to look at what makes change stick, what helps to create longevity when you're trying to drive change and improvement as well. And the kinds of questions that evidence can answer are numerous. The number of questions it can answer is as long as a piece of string. But you can look at things like the kinds of challenges or opportunities that you might face when you're trying to make improvements to something. What have the pitfalls been in projects that other people have done in similar contexts? What sorts of opportunities, technical developments, policy changes are coming up on the horizon? What are the strategic benefits of doing this? What's this going to let us do in the future? Why do we need this? Again, in the kind of change management sphere of things. And it can also help with things like bids and tenders for funding as well. And probably the most important question of all, what do people actually need? What demographic challenges or social determinants of health are people dealing with? Who comes through your doors? What do people actually think is important when co-producing an intervention? Because if you're anything like me, you'll have some really cool ideas and then think, what use is this going to be? What's it actually going to do in practice? So particularly grey literature and that kind of tacit knowledge, that people-based knowledge, can both be really helpful in answering that kind of question. So here are a few short examples of libraries supporting QI and clinical effectiveness. In one of our next door trusts, Portsmouth University Hospitals NHS Trust, the library service a few years ago did a search to support a project that was aimed at reducing behaviours of distress on acute wards and in the emergency department there, because there had been an uptick in violent and aggressive behaviour against staff, because people were becoming distressed and feeling unable to express themselves in other ways, I think. There was some bespoke training recently done by a colleague in Somerset NHS Foundation Trust, and that colleague is also a QI librarian. And that was training in evidence searching and knowledge management in sort of keeping documents accessible, usable, making them sort of findable by various people within an organisation as part of the QI training offer in the trust. And in my 4 or so years in Solent, I've done quite a lot of searching to support workforce developments, workforce planning, and to support and guide approaches to service redesign in 3 of our service lines. So I'm going to give you a few minutes to access and add to the Mentimeter, and a couple of minutes to sort of digest what you've heard as well. And we'll see what's coming up on the Mentimeter. Ooh, evidence change events. Interesting. And offered clarity. Fantastic. That's definitely one of the things we hope to do with the evidence. And if you would like to, you can also expand on any of your answers in the chat as well, so that we can all be learning from each other. And I will be learning from you as well, helping with engagement, understanding current policy and guidelines, best practice, new research, and experiences of other services. Fantastic. And coming from that sort of clinical governance angle as well. Identifying if your QI is having a positive impact. Yes, very, very much so. And as ever, the Mentimeter is completely and totally optional, but it's really nice to see people engaging with it and people pulling out their own learning on it. Supporting the decision making, yep. And something that we are quite keen on in the service here, and something that a lot of library services are developing, is that idea that we're not just here for clinical staff, we're also here for corporate staff. And that can be anyone from apprentices who are doing level 2 business studies to folks in the IT department. We've worked with people from HR, patient information, patient experience team. We've worked with people from our adult governance team. And that sort of business of making improvement accessible to everybody, getting people involved at all levels of the organisation, demystifying things, is very much part of the way we work, both in the library service and I think as the academy as well. So I shall check the chat. So does anyone have any questions so far? Nope. All right. Usually if I ask if there are any questions and there's silence, I know that either I'm doing right or I've stunned everybody into quiet. So we shall see. But as I say, do pop your hands up or put things in the chat if you would like to ask anything. So the next part is a very quick whistle-stop tour through a couple of quick resources. The Knowledge Hub, or Knowledge and Evidence Hub, is run by NHS England, and it is the library searching page. It's good for access to full text articles, And if you are a member of an NHS library, it's also one of the easiest ways to request things if you'd like an interlibrary loan of an article. And I'll show you that in a second. But we're really focusing on the fact that it's also a bit of a one-stop shop for things like the BNF and BNF Children's, for guidelines, and for some different grey literature sources as well. And I'll also show you a way of using Google to find some good, relevant grey literature sources for QI work as well. So the NHS Knowledge and Library Hub searches a really wide range of different resources in common with university search engines. It's something that you can access through your NHS Open Athens account, and quite a lot of trusts, including ours, have links to the hub and search boxes for the hub direct from their library pages. So it's a good thing to be able to access. I also know that some of our colleagues in acute libraries I have no idea how they managed it, but bravo to them, have also managed to get the Knowledge and Library Hub included in patient notes software and clinical decision-making software as well, for instant access to the evidence. That is fantastic. So you have your search box here. I won't take you through a search today, but as you can see, it's also got links out to a whole bunch of different evidence resources. You have BMJ Best Practice, which for those of you who haven't met it yet, is a point of care tool. And it's there to give you a sort of brief, up-to-date idea of the evidence on particular conditions or symptoms, including emerging treatments. Quite often it will have evidence tables, which will either link you out to Cochrane clinical answers that have come out of systematic reviews through Cochrane, or evidence tables for the amount of evidence for different treatments and the quality of that evidence as assessed by BMJ. You've also got access, as I say, to the British National Formulary and the British National Formulary for Children. Nice clinical knowledge summaries and treatment pathways for common conditions. And your classic textbooks are also here, the Royal Marsden Manual and the Maudsley Prescribing Guidelines. And particularly for clinical governance, audit and evaluation work, you also have the link out to your NICE guidance. Under the Other Resources tab, you also have some resources from e-learning for healthcare on evidence searching and critically appraising the evidence. There's a link to the searching course in the resource list at the end of the workshop, and it is freely available from e-learning for health. You've got health literacy and patient experience library as well. That can be a really useful resource for bringing together some of that tacit knowledge. There are also links out to different grey literature resources, and we also run a quality improvement and risk bulletin which is mostly focused on resources that are useful for community and mental health trusts, given that's where I work. And that takes in grey literature from things like the Health Quality Improvement Partnership, the Health Foundation and the King's Fund, as well as a roundup of recent journal publications as well. And many NHS libraries run quality bulletins, and you can access a list of them if you put in NHS bulletins list in Google, and you can sign up for whatever you choose. I'm also going to show you how to use Google to bring up some relevant resources. A search that I did a little while back was on referral practices for video fluoroscopy based on international dysphagia staging guidelines. So if you put in, basically putting in what you're looking for and then adding NHS to narrow it down can be just as good as a fancy Google search with ands and ors and nots sometimes. So referral criteria, video fluoroscopy, NHS. So if we put in what we're looking for and our topic, you can see that we've got how to refer. We've got some patient videos and leaflets as well. And this can also work for things like bids and tenders, seeing who has been awarded contracts for NHS services. There are websites and public procurement information on the government website that you can access for those kinds of questions as well. And essentially, if it is publicly available, you should be able to access it through Google. So this is a very, very short idea of the kinds of things you can find with a Google search. You can also use a similar method on Google Scholar. Google Scholar, up until fairly recently, most librarians were a little bit wary of Google, and quite a few of us are still quite wary of Google's AI searching. But Google Scholar can be really good if you don't have an NHS Open Athens account. So, for example, if you work in the third sector, for finding free publication copies of journal articles that may have had some changes between that copy and the published one, but will give you an idea of their content. It can also be quite useful for seeing where things have been cited if you want to do a bit of bibliography searching. And you can also find things like dissertations through NHS, through Google Scholar as well. So this is sort of worked example of a possible QI project and where the evidence might fall in that process. So this is Sophia. She's a ward sister on a general ward in a local district general hospital as part of an acute trust. She's been looking after someone with profound and multiple learning disabilities, PMLDs, fed by percutaneous endoscopic gastrostomy, or PEG. Some of you might know it as a Mickey butt. After medication had been administered through it, the patient's tube has become blocked. Staff try to clear the blockage, but they're not able to. And given that it's a Sunday, there are no specialist PEG nurses on site at the weekend, so it can't be easily changed. But the patient's family comes to visit after having gone home for a rest earlier in the day. And Sophia asks the patient's mum what works when it gets blocked at home. And their mum tells Sophia that she usually uses fizzy water. I've also heard of Coke and Sprite being used in these kinds of circumstances. And miracles, it works. The team starts to wonder if this might be a problem that they will come across again, and whether or not they need a solution for things like this that happen at the weekend or when they're not able to engage specialist nurses because they're with another patient, for example. So what does Sophia do next? So a lot of people on the call will probably have at least some experience of taking a QI project to fruition. But Sophia and their team have had the idea for the fact that they may need a policy or a way of dealing with blockages in PEGs during weekends and out of hours. So the next thing would be to gather information. And in this case, Sophia would be gathering information from friends who work on other wards in the hospital, from the gastro team, and possibly also from her colleagues in community nursing, because some community nurses, particularly community paediatric nurses, may have some experience of gastro care. And that would be a really good example of her using that tacit knowledge to develop her topic, to develop her understanding of whether or not the problem is a common one, and how she's going to approach the topic in terms of asking for extra support from other specialists in the trust. And her colleagues tell her that it's not the first time they've seen it happen either. They don't have many patients with PEGs. I think the number for the UK is between 40 and 80,000, approximately. But it's something that has happened before on their wards, on the odd occasion that someone has come in. So Sophia decides that this probably is something that they need to have some information on, just in case. She goes to her library team, hooray, and one of their specialist librarians does an expert search for her. And expert searches from librarians can be for very sort of well-bounded, short clinical topics like what does this medication interact with in people in this age group, for example. But we can also do full-scale evidence searches for much wider topics. Quite often there will be an element of grey literature, particularly in community and mental health settings where that may be more appropriate. And in teams where things like QI and patient public involvement are linked, like the Academy, We may also want to refer people on to other specialists within different areas of the trust as well. The search from the library team comes up with some figures. Now, me being a librarian, I did quite a basic search on this. And depending on the source, blockages in PEG tubes can occur in between 20 and 40% of users of PEG feeding, which is not insignificant, and it can mean that you've got a fair chance of encountering a blocked PEG on a ward or in the community. So Sophia takes that to the QI team and says, we think this is something we should prepare for. How do we go about this? The QI team takes her through the process of putting together her topic, interweaving the evidence that she's already got from her colleagues and from the library team. The process of doing things like plan, do, study, act cycles. And she comes up with a project that looks at putting together a short policy with a crib sheet on different methods for tackling this, using published evidence on things like gastrostomy research, tacit knowledge from staff experience, and the ways that people have dealt with this before, and also taking in what families and people with PEG feeding also do in this situation. She runs some surveys to find out how people would deal with this problem at home or in their place of work. She gets the library to do an additional search for information on the safety of different ways of dealing with tube blockages. She brings together the policy and then she tests it with her colleagues and families and people who have gastros to make sure that it is usable, to make sure that it reflects people's experiences of having and using these devices, and checking whether or not it matches up with current practice, current guidelines, and trust practice and policy as well. Once she's done that, once she's gone through any of the governance processes, and once she's tested what she's come up with, you have the results and the reflection on what's gone well, what the impact or not of the project has been, benchmarking it against the way that other organizations have solved these kinds of problems, and looking at how other organizations have disseminated their findings and made sure that the learning and the lessons that have been taken from the project are used as well as they can be. That leads on to Sophia being able to plan for the future, whether or not that is another PDSA cycle to further develop the practice in this area, whether or not it is working in partnership with the gastro team and their community colleagues to create something like a journal club or a community of practice on specific topics, and whether or not that is developing her own skills further, having had the chance to build her confidence through this kind of project. And we can see that different kinds of evidence have come in at different points, been used in very different ways, applied in different ways, and had very different impacts as well, from the tacit information from that initial gathering to the searches from the library team, the tacit knowledge and the organizational knowledge assets, things like QI templates from the QI team, developing that tacit knowledge and that knowledge of the methodology through building and administering the project, using the evidence to develop how you reflect and assess and evaluate what happened during the project, and having a look at how other people have used this kind of knowledge further on as well. Oh, excuse me. So having heard all that, and having heard me talk at you for 45 minutes, we'll go on to the last of the Mentimeters. What might you do differently now that you've heard about the role of evidence in QI? And this is a bit of a call to action, really. It gives you some options for how you might be able to use evidence further in your work and in how you talk to the people that you guide and work with about the evidence as well. The Mentimeter. Excellent, we're getting use my library more. You found my ulterior motive. Promoting libraries and linking in with that QI work is definitely something that we as a service installment have sought to develop. It's something that's a growth area for a lot of libraries, both in acute and in mental health community settings. And planning projects to include the evidence, it's really heartening to see that people have selected that one. And using different kinds of evidence as well. Being a bit freer in how we define evidence can be something that is really useful for us and exposes us to a bit more of a lateral or interdisciplinary way of working and learning from places that we might not have thought of, whether that is, as I say, education, social work, social care, public health for things like quality improvement for preventative health, things like the literature on change management for workforce management and workforce planning. So the possibilities are endless, really. And the art of finding the evidence is the art of finding what's out there, but also where the gaps are and where you might be able to fit and explore. So to conclude, we've seen that evidence can save you stress from wondering, where do I go now? And trying to pick from a huge, daunting range of possible metrics, ways of evaluating things, ways of running a project. It can save you time because it can make you aware of pitfalls that other people have faced in similar projects, and effort as well. Because if there is good practice elsewhere in the NHS or in another discipline, then you can build on that. It's useful at lots of different points in a project, including from the very beginning and the write-up at the end. And it's not just for clinical improvement. You can use it for developing or updating policy, service redesign, strategic planning, horizon scanning, clinical and corporate governance, and things like clinical effectiveness and demand and capacity work as well. So we have our resource list here. If you don't already have an NHS Open Athens account, I would strongly recommend that you see if you can get one. If you can't access Open Athens for whatever reason, then you may be able to access different databases through your local public library. And you can also access research databases on Epistemonikos, access to research and PubMed. Other databases are available. Please don't take this as an endorsement of any particular source. You can email me to sign up for our Quality Improvement and Risk Bulletin, or you can have a look for NHS bulletins on Google and see the range of QI and governance bulletins out there. I know that my colleagues in Southern also have a bulletin that they do regularly. And you can also access the free version of the e-learning for health evidence searching course from here as well. These are the general contact details for the Academy, as always. I shall stop sharing my screen. And hopefully that has been a useful introduction to the use of evidence in both simpler and more advanced ways for quality improvement and improvement adjacent type work. If anyone has any questions, please do speak up or put them in the chat as well. All right. So hopefully, as I say, that means I've answered the questions you might have rather than stunning you into silence. But thank you very much for your time. Thank you for your attention. And I'll be able to give you a few minutes of your day back. Great. Thank you for the reactions, folks.